health condition that affects 1% of the general population. There's a lot of misconception about schizophrenia. Some people usually call it that it's an evil attack. Some believe that it's a medical condition. So today we are going to talk about schizophrenia. So I have a guest who will help us to introduce schizophrenia. So I welcome Dr. Inadosiba.
Thank you, Prophet.
So what is schizophrenia and how does it affect someone's mental health?
All right. Thank you for the question. Schizophrenia is a serious mental health condition that affects how people think and how they regulate their emotions and also make decisions. So it can come with symptoms that we regard as psychotic symptoms. These behaviors becomes out of the experience that becomes out of touch with reality, like hallucination, where the person starts to hear things other people around him or her do not hear, and also see things that people around him or her do not see, and also believe things that are the wrong premise. So this is what schizophrenia is.
So in other words, schizophrenia is a condition where you see somebody claiming to hear voices of people. Some may be saying some people are talking about them where there's not anybody around. Some people may be coming up with some belief that people want to attack them. They may be saying the CIA is monitoring them. They will be coming from all sorts of claims that when you verify, you cannot even, there's no evidence supporting those something. So Dr. Onadosi has defined schizophrenia for us. So what are the key symptoms of schizophrenia?
All right, there are many symptoms of schizophrenia. We tend to categorize them in three categories: like positive symptoms, the negative symptoms, and the cognitive symptoms. The positive symptoms are part of the ones that we've talked about, where you have hallucinations, have delusions. The negative symptoms includes when people lack the motivation to do anything, where they just want to wake in the morning, eat food, sleep, no motivation to do anything. And there are others, the cognitive symptoms include the person has lacked the ability to make memory has problems, the attention has problems, and can't make good decisions. Thank you.
All right, thank you so much. Let's go to how does schizophrenia differ from other mental health conditions like bipolar disorder or depression?
Just like we said initially, schizophrenia has to do with these psychotic symptoms. Where in contrast, other mental health disorder like the bipolar affective disorder have to do with mood swings, where the person have this period of high and have this period of low feeling, and something like a depression has this prolonged sadness accompanies it. So you see, in these ones, it may not have this. We will have these psychotic symptoms like hallucinations and delusion. Schizophrenia have this effect on the cognition of people that it starts to, over years, it starts to affect the cognition of the sufferer, unlike the other mood disorder.
You need to come to our level. We need to know what cognition is all about, so that some people who are not as highly that they understand what cognitive function is all about.
Okay, a cognitive function includes the person's ability to, like the memory, remember things that he or she had known in the past, or even form new memory. Okay, so I will talk about the person's ability to concentrate, to concentrate on things, the ability of a person to be able to make rational reasoning, be it mathematical or verbal, or in other words. So this is about the person's everyday, and this functioning, this cognitive function is about person's everyday interaction with the external environment and things. So once it's impacted so much, it's the kind of thing you see in schizophrenia.
All right, thank you for this strong light on what cognition is all about. So let's go on to at least what are the causes of schizophrenia? Because some people will say it's a spiritual attack, some will say it's by the way even the illness present, it tends to look as if there's a spiritual component to it. So what are the causes of schizophrenia?
Thank you. The causes of schizophrenia, or the cause of schizophrenia till date, has been a problem because we tend to ascribe things that we don't see or touch to spirits. But science has shown that because there's a genetic involvement in this condition. Like when you see someone that the father or the mother have this problem, the person's likelihood to have the problem is increased, unlike the person that don't have that in the family. So there are these genetic factors that are involved. Then the neurochemical state of the person, and also the environmental factors. There will be studied that some persons that are born within a period of time will come down with this because of the time they were conceived. The mother may have been infected with a kind of flu-like virus, and when they are now born, they are more likely to come down with this condition. So this factor is multifactorial, but genetic factor is very important.
All right, thank you for that insight. So at what age does schizophrenia usually appear?
Schizophrenia most times appear from late teens to early 30s. It majorly appear more, the symptoms appear more in males early enough than the females. However, the males tend to start to show symptoms from late teens to 20, early 20s, while the females start to manifest from that 20s to 30s. To even early 30s, the females tend to have this bimodal peak periods where they tend to have show these symptoms. So it affects both male and females. It's said to affect like 1% of the general population. Thank you.
All right, thank you. Can schizophrenia be cured, or is it a lifelong condition?
Schizophrenia is treatable. We have over the years applied science, and it showed that with medication, therapies, and social support, that schizophrenia have been treated effectively. And all the medications will include the mental health experts prescribe these medications. Then the therapies will help the person to understand the illness, know how to navigate both what has caused the stress that may have precipitated or have continued to make the illness to stay, how to navigate through them, and generally, people have lived and they live well. So treatment is very important to improve quality of life of people who have this condition.
Thank you for that beautiful insight. What are the more common misconceptions about schizophrenia that people should know?
A whole lot of things have been said about schizophrenia. Time won't permit us to talk about the history of schizophrenia. But people up till now believe that spirits are largely involved. And some persons have thought that people can pour powder at your door and you come down with schizophrenia. And some persons, I believe, will project it from somewhere and the person comes down with schizophrenia. And most often than not, people have also said that maybe the person had malaria and they entered into the head and now gave rise to the schizophrenia. So a whole lot of misconceptions are abound, and we hope that with time, people will begin to understand and know that this is an illness on its own.
I remember people usually say that if somebody is in the mental health facility, maybe the person might be attacked or the person might be injured by the patient with schizophrenia. Is this one true?
Yeah,
but that is one of the most misconceptions.
People have thought that once the person has a mental illness like schizophrenia, and the person is violent and person is destructive. That's what people have thought. But it's not true. It's not true because the people that, in fact, in the past 1 year, I don't think that I've seen any person attacking anybody in the clinics. People that with schizophrenia comes, people even in the world, and they go about and we've not heard about the patient attacking anybody on the way or even while in the clinic. So these things are not true. They are myths that people have concocted in their mind.
So what advice are you going to give to the relatives of those suffering from schizophrenia?
Understanding schizophrenia is key, because no matter how much you want to help this person, and you don't understand actually what the person is going through, it may not even give you the platform to help the person appropriately. Understanding it is key. So most times, social support, the relatives, are the first line of social support for people with schizophrenia. And if you understand the illness and understand even to watch out for relapse symptoms, they can help mitigate the challenges of schizophrenia. They can help prevent relapse. They can even help a whole lot in different dimensions. Help these persons come out better with good outcome if they actually give adequate social support to these persons.
Thank you viewers for your patience. So Dr. Inadose has made us to know that schizophrenia is a medical condition, not a spiritual attack. And he has also made us that it is treatable and has made us to know that whoever that is schizophrenia, if properly treated, can go back to society and function effectively. So if you have someone that you know that is having schizophrenia, so it's better you advise them to go and see healthcare professional and then comply with whatever advice that they give you. So stay tuned until another edition when I'll be giving you, bringing another expert to come and talk about other mental health condition. Dr. Ondadose, you are welcome.
Thank you for having me.
Another time we'll be calling you
thank you.
to come and give us insight on other mental health condition.